Hello, this is Aaron Shoemaker, and I'm here with your biweekly medical group update again today. And today we're fortunate to have Jonathan Nally, the CEO and president of St. Vincent, with us. Jonathan's going to talk today with us about the future of healthcare in St. Vincent and reimagining our delivery of healthcare.
Aaron, thanks for having me, Doc. I really appreciate it. Thank you to you all for all the work that you're doing and the opportunity to use this vehicle to reach out, chat, encourage dialogue, as well as follow-up that comes along with it.
Great. So, Jonathan, how do you see us becoming the system of choice in the future?
Well, as you know, St. Vincent has its roots all the way back to the 1870s when the Daughters of Charity took over that Marine Hospital on the banks of the Ohio River in Evansville in 1881, and then we've continued to grow the last 130 years overall with new entrants, new additions, new acquisitions, new partnerships, and with it, the idea about how do we evolve and innovate and connect with our consumers and patients has been a priority because, as you know, patients needs changes, community needs changes, and it's our job and our responsibility to continue to ask that question overall about what does it take to meet a patient and a consumer and a community's needs.
So what are some of those key strategies that you see that we need to make changes in?
The first is, how do we as a system have a mindset of what are we doing to meet a patient's needs and what do those needs look like? As you know, as medicine has advanced and evolved, so too we as a ministry advance and evolve based on what the needs of that community look like. And for us, it is connecting with a patient where they want to be connected. We've got enough data that shows that patients' needs have changed greatly, but also they're much more educated consumers of healthcare as a delivery expectation. And with it, where do they want to be met? In their homes, on their smartphones or devices, in their workplaces, versus such traditional models of coming to the office for a scheduled appointment that they don't make, that is made for them. They want command and control, and so how do we do that? Through neighborhood hospitals in the communities, our St. Vincent On Demand, the ability for patients to schedule office visits and testing services in and throughout locations of St. Vincent, and then continued follow-up and connection so that we're not so episodic with our patients, but they feel as if we're holding their hand from prenatal to end-of-life care.
That's great. As we make those changes, and these are new things that they're seeing in the market, how do we let the consumers know about this so they know what our vision for healthcare is?
Absolutely. We've been having a lot of conversations about what is reimagining healthcare. And that's got to be one of our foundational messages so that our patients and community realize we're constantly doing this. We're not reimagining now for the next 5 years. We should be in a constant state of reimagination. And that is embracing change, enhancing innovation, testing it. If it doesn't work, it's okay. Celebrate that failure and try something else, but constantly communicating with our patients that we want to know what's on your mind. We want to know what your needs are. How do we meet your needs? And then trial and test a number of those elements as we continue to evolve, which will be a constant state for us, because what our patients have shown us is they want the right care at the right place at the right time, the way they're requesting it, which is big, and that's a change for traditional healthcare delivery systems.
Thanks, Jonathan. I'm very excited about the changes we're making to really bring up the level of care and standardized care across the state of Indiana with all the work and vision that you've put in place. Is there anything else you'd like to tell our clinicians before we go today?
You have done a phenomenal job, and you continue to do a phenomenal job. As we reimagine, focus on what does innovation look like. Focus on how do I meet the needs of my patients, and it's okay to ask them that question because then we can take that and learn from that. The other piece is the alignment of how we deliver care needs to continue to break down and move past geography and socioeconomic status more than ever. And so the alignment of pathways and protocols, I know at times can be difficult, but we should be able to be consistent in how we become that continued provider of choice. We have GetStVincentCare.com, which is a website that is consistent across the entire state of Indiana that lets our consumers see one entry point and move from there. as well as what are we doing to reach out in areas where we have not had large locations, large impactful areas. And so what you may not know, last year we had $269 million in community benefit and care for the poor, as well as we're excited about the new clinic presence that we have because of you all at Gleaners Food Bank, where we're reaching out into communities to connect with patients who would not otherwise see a physician or a provider. So thank you for that. It's making an impact. And so continue to embrace change and innovation, because we have to continue to disrupt ourselves and be okay with evolution, trial and error and failure, and trying and learning from those and celebrating those, and continue to do that because you are making a difference in our medical group practices. So thank you.
Thank you, Jonathan. Thank you for taking the time to directly communicate to our clinicians and to our clinics.